Good morning. This is Rae Anne and I'm here today with Dr. Andy Esch, a palliative care physician. Welcome.
Thanks, Rae Anne. I'm super happy to be here and talking to you.
Can I call you Andy?
Yes, for sure. Yeah,
Great, thanks. So I wanted to talk today with you about the importance of palliative care when dealing with patients with serious illnesses who are placed on serious pain medications and other medications as part of their care and part of the journey to get them back to a point where they're functioning again. I can share with you that when I was diagnosed with stage 4 head and neck cancer, I had to undergo 35 radiation treatments to my head and neck area, which resulted in a lot of pain, a lot of discomfort that required me to be on some pretty serious medications, fentanyl, oxycodone. And one of my biggest fears, on top of all the other fears that come with a serious illness diagnosis, was what life was going to be like at the end of treatment and at the end of being on all these medications, and how important palliative care was in getting me to a point where I could successfully come off the medications after being on them for a significant amount of time.
There's a sense of anxiety and even loss as people go through treatment and then start coming to the end of it. And I think that anxiety and sense of loss is that you were on such a, I wasn't part of your care team, but all patients with serious illness, it's so regimented when you're getting your chemo and your radiation and your follow-ups and your blood work. You are really in touch with the healthcare system almost continuously, right? And then as you start winding down towards, okay, I'm going to finish my radiation and chemo, or whatever my treatments are, what's going to happen? Who's going to manage this? Or am I going to be on these medications forever? Or do I start tapering off? You have all these questions, and the health system really backs away, because they think we've treated the illness, you're better now, get on, go on with your life. Well, it's just not, as you know, having lived through it, it's just not that easy. I mean, there's lingering after effects. There's, a lot of patients feel anxiety. Every ache or pain that I might have, or somebody who doesn't have an active cancer, didn't just recently go through treatment, they might just brush that pain off as, that'll go away tomorrow. But for someone who's a cancer survivor, it means something totally different. And so who do you talk to about that? Who are you following up with? And that's what I mean by a sense of loss. You feel like you're, all of a sudden you went from being in touch with people almost daily to not even knowing who to call. Who's the quarterback now? Who's coordinating my care? Who do I call when I have questions? And that's a scary time. You brought up, pain and pain management too. There's also, when you're going through active cancer treatment, it's a lot more streamlined and easy to know who's going to be managing your pain and what avenues you go through to get that. But when you finish treatment, who's going to take over the pain management? How long do you still have to be on pain meds? And it gets a lot trickier. So I think how you describe going through that and transitioning into the after treatment is a really vulnerable time for a lot of people.
Palliative care came in at such an important time in my treatment. I had finished my chemotherapy. I had finished radiation. I was pushed in with the palliative care team, and what a difference it made as far as managing different side effects and different physical things that were happening with me as I progressed through the recovery period. What was so beneficial to me was the relationship I had with palliative care and the teams that were taking care of me afterwards, my pharmacist, my physical therapists, my swallow specialists. Can you speak to how palliative care can make those bridges for people that are going through serious illnesses and the recovery?
I think all palliative care teams focus on the patient and the caregiver and their experience of living through the illness. And so when we define palliative care as being that extra layer of support for patients, I mean, palliative care teams live that motto. We really look at what matters to my patient and their caregivers or family, and how do I link them to the resources in the community or the resources that I have at my disposal to make what matters to them the most important thing in their care. And so that's why palliative care is set up as a team, because to think one person like me as a physician could know all the community resources or the psychological or maybe social or even spiritual issues you might be going through with why did this happen to me is not always a medical question. It's sometimes a spiritual question, right? So you need a team of people with specialty training to be able to address those needs. And so I think your experience with palliative care reflects that the beauty of it as a subspecialty, in that it recognizes that we are complex human beings, complex issues that we're going through every day, but then you tack on serious illness and those things get even more complicated. And so, having a social worker that knows the community resources that you might need linked up to, or the nurse practitioner, maybe physician or PA, whoever it may be, who knows that you may need a swallowing avail and some diet modification. That not one person can know all that. So that's why it's the importance of a team. And I think the experience you had with your palliative care team, my guess is you probably had interactions with not just a physician, but physician, a nurse, a social worker. It sounds like you had speech therapy and other people involved too, which is great.